Hi, I'm Leon Chaitow. I'm an osteopath from the United Kingdom. I'm an author, lecturer, practitioner. What we're going to do today is to look at an integrated sequence of neuromuscular inhibition of trigger points. It incorporates ischemic compression, performed in an intermittent way rather than as a constant compression, until there's a change in the circulatory status of the tissues and until the patient begins to report a change. Then we'll introduce positional release, combined with a local isometric contraction of the tissues around the trigger point, followed by a local stretch, followed by a whole muscle contraction and a whole muscle stretch, which I find is a very effective way of dealing with myofascial trigger points. So Kim, I'm going to be feeling around, palpating the skin, looking for skin changes which may reflect an underlying trigger point, which may be causing the facial pain that you've been telling me about. I think I can feel a certain dragging sensation there, which usually means increased hydrosis, some degree of sweat activity. So there may well be a trigger point exactly under my thumb. So I'm going to try and compress that, and you tell me what you feel. Tell me if that produces a pain. Does that feel painful?
Yes.
Is it just local, or is it spreading towards your face?
It's spreading toward my face.
Okay. Is that similar to the pain that you get in that area?
Yes.
So that suggests an active trigger point. So I'm going to be pressing on this for a few seconds and then releasing. And I'll keep doing this a few seconds, 3, 4, 5 seconds on and 1 or 2 seconds off. Now what should happen after a number of repetitions of this is that the pain should change. And you tell me when it begins to change while I'm pressing. So compressing the trigger point, trying
to change a little bit.
Okay. Is that changing locally? I'll just ease off. Is it changing locally where I'm pressing or in the face? Or both?
Both.
Okay. And when I say change, is it decreasing or increasing?
Decreasing.
Okay. Okay, that's the beginning of the process. So we've been giving it this compression and decompression to introduce a circulatory change. Now I'm going to press, and I want you to, whatever you can feel now, I want you to give it a value of 10. And tell me as it changes, tell me what happens to the score of 10 as I reposition perhaps your head first. Is the score any different now?
8.
Okay. Can you bring your arm across your chest, and I'll just add a little crowding and compression there. What's the score like now?
6.
Okay, if I give it a little bit more compression, slackening the tissues, what now?
5.
Okay. And now?
3.
Okay. Now I want you to maintain that position. I'm going to stop pressing and I'm going to stop holding your shoulder here. So can you actually draw your shoulder towards your ear a little bit?
Yes.
And your shoulder towards your ear. Right, so we've got a nice contraction around the trigger point. The tissues surrounding the trigger point are isometrically contracting. We hold that for about 7 to 10 seconds. And release. Let it all go. Just keep your arm there, and I'm going to try and get my fingers each side of that trigger point. Slide my hand in here carefully without knocking you too much. Can you take your left ear towards your left shoulder? And now put your arm down by your side and stretch it away towards your feet. So you're now introducing for me a stretch. You can relax your arm, relax your head, and we're trying to lengthen the tissues surrounding the trigger point. It's a very localized stretch, following on from an isometric contraction, following on from a positional release. And after about 15-20 seconds of that, as the tissues begin to lengthen, I'm going to ask you to bring your ear and your shoulder gently together now, using about 1/4 of your strength, no more. And we're going to stretch the whole muscle. Okay, and release. And let's just ease your head to its barrier into side flexion. And now stretch your hand towards your feet again. And the whole muscle is now being lengthened. So this sequence, which is a combination of compressive, ischemic compression, intermittent compression, positional release, local isometric contraction, local stretch, whole muscle isometric contraction, whole muscle stretch, combined, known as integrated neuromuscular inhibition, should deactivate that trigger point, and then we slowly release. I'm going to go back and repalpate. See a slight reddening where I was pressing. Now it may still be sensitive, but is that as sensitive? Is that radiating in the same way as before?
No.
Okay. And that's enough for today. I'm Leon Chaitow, and I've tried to demonstrate for you an upper trapezius trigger point treatment involving a combination of modalities put together to deactivate the trigger point.